Bismillahirrahmanirrahim. Assalamu alaikum. Today the topic of my video is humerus. इस वीडियो में मैं ह्यूमरस की एनाटॉमिकल पोजीशन, उसकी साइट डिटर्मिनेशन, बोनी लैंडमार्क्स और कुछ इंपॉर्टेंट रिलेशंस के बारे में बताऊंगी. Humerus is actually the principal bone of the upper arm. It articulates with the scapula above and the radius and ulna below in order to form the shoulder and the elbow joints respectively. Humerus is actually a long bone, इसलिए it can be divided into three parts. One is the upper part or the proximal end. Then we have the shaft, that is the longest middle portion of the bone, and below the shaft we have the lower part or the distal end of the humerus. Now coming towards the upper part or the proximal end of the humerus, you can see that we have this rounded smooth part. This is known as the head of the humerus. This head actually articulates with the glenoid fossa or glenoid cavity of the scapula, and it forms the glenohumeral joint or the shoulder joint. Just below the head of the humerus, you can see कि यहाँ पे हमें एक पतली सी depression नज़र आती है. This is actually the anatomical neck of the humerus. Similarly, the humerus has another neck, that is the surgical neck, जिसकी demarcation point कुछ यहाँ पे होता है, जो कि एक imaginary demarcation point होता है. इस एरिया पे एक्चुअली हमारे पास auxiliary nerve पास करती है. तो whenever there is a fracture of the surgical neck of the humerus, then it will result in the damage to the auxiliary nerve. On the anterior aspect of the proximal end of the humerus, we have these two projections. These are actually known as tubercles. This is the lesser tubercle, that is smaller in size, and this is the greater tubercle. Lesser tubercle actually gives the site of attachment for the subscapularis muscle, and the greater tubercle that actually extends to the posterior aspect of the proximal end of the humerus. On the posterior aspect, the greater tubercle gives the site of attachment to the infraspinatus, the supraspinatus, and the teres minor muscles. Anteriorly, in between these two tubercles, we have a slit-like depression. This depression is known as the intertubercular groove or the bicipital groove. इसको bicipital groove इसलिए कहते हैं क्योंकि long head of biceps इसमें से क्रॉस करके coracoid process पे जाके अटैच करता है. Now coming towards the shaft of the bone, anteriorly अगर हम गौर करें तो मिड शाफ्ट पे या जस्ट नियर टू द प्रॉक्सिमल एंड यहाँ पे हमें एक रफ सी सरफेस नज़र आती है, एंड दिस सरफेस और दिस पॉइंट इज़ नोन एज द डेल्टॉइड ट्यूबरोसिटी. इस एरिया पे डेल्टॉइड मसल अटैच होता है. On the posterior aspect of the shaft, just near to the lower end, we have a spiral groove. This spiral groove is known as the radial groove. इस groove में हमारे पास radial nerve पास करती है. So whenever there is a fracture of the mid shaft of the humerus, then it will result in the damage to the radial nerve. Now coming towards the distal end or the lower part of the humerus, we can see that it is roughly triangular in shape. This is the lateral border and this is the medial border of the lower end. Anteriorly, on the anterior aspect of the distal end of the humerus, you can see these two dilated portions at the lower aspect. This is the trochlea जो कि medially lie करता है, and this is the capitulum. Capitulum actually articulates with the head of the radius below. Just above the trochlea and the capitulum, we have a fossa. This is known as the coronoid fossa. Laterally, this projection just above the capitulum, it is known as the lateral epicondyle, and medially this dilated projection that is bigger as compared to the lateral one is known as the medial epicondyle. Medial epicondyle actually gives the attachment site for the flexors of the forearm, whereas the lateral epicondyle gives the attachment site for the extensors of the forearm. On the posterior aspect of the lower end of the humerus or the distal end of the humerus, you can see that we have this depression. This is known as the olecranon fossa, and in this we have the olecranon process of the ulna. In this olecranon fossa, the olecranon process of the ulna will get fixed. अब जबकि हमें सारे पार्ट्स और इम्पॉर्टेंट सर्फेसेस और बॉर्डर्स के बारे में मालूम हो चुका है, तो अब हम ह्यूमरस की साइट को डिटर्मिन कर सकते हैं। तो जैसा कि मैंने आपको बताया कि जो हेड ऑफ द ह्यूमरस होता है वो हमेशा मीडियली लाई करता है, और जो लेसर और ग्रेटर ट्यूबरकल्स होते हैं वो एंटीरियर एस्पेक्ट ऑफ द ह्यूमरस पे होते हैं। इसी तरह अगर हम इन्फीरियरली बात करें तो यहाँ पे कोरोनॉइड प्रोसेस जो है वो एंटीरियर सरफेस पे होगा, और मीडियल एपिकॉन्डाइल और लैटरल एपिकॉन्डाइल की पोजीशन से भी हम ह्यूमरस की साइट को डिटर्मिन कर सकते हैं। तो इन पॉइंट्स को मद्देनज़र रखते हुए वी कैन ईजिली से दैट दिस इज़ एक्चुअली द राइट ह्यूमरस।